While the media slammed the use of hydroxychloroquine, numerous studies show countries which have used the drug are doing much better than countries that haven't. One America's Pearson Sharp has the details.
Despite ongoing media controversy surrounding the drug hydroxychloroquine, multiple reports are emerging that countries which have used the drug are faring much better than countries which haven't. Doctors and researchers from the Association of American Physicians and Surgeons counted up the fatalities around the world and found a startling trend. Countries which have encouraged the use of hydroxychloroquine, including South Korea, India, Russia, Israel, and even South Africa, have managed to contain the virus far better than countries like the United States, where politicians have vehemently opposed its use. At the onset of the outbreak, the government received numerous donations of hydroxychloroquine, totaling nearly 100 million doses. Yet leaders in Washington have refused to make it available to the public, despite urgings from President Trump. Dr. David Nazarian, a physician in Los Angeles and diplomat of the American Board of Internal Medicine, says the difference in countries which allow the medicine's use are striking. Nazarian adds that the correlation between how much better patients taking hydroxychloroquine are doing compared to those who aren't is not just a mere coincidence. He points to countries in Africa where hydroxychloroquine is taken widely and prophylactically to protect against diseases like malaria. Incidentally, these countries have some of the lowest levels of coronavirus infections and deaths anywhere in the world. For example, Uganda, which has the 6th highest number of annual malaria deaths, has been treating malaria and coronavirus with a combination of zinc, azithromycin, and, of course, hydroxychloroquine. As a result, Uganda, a country with a population of over 45 million, has had just 1,100 coronavirus cases and only 2 deaths. 2 deaths out of 45 million people. Meanwhile, in the U.S., the latest numbers claim some 150,000 Americans have died due to the coronavirus. It's important to note, however, credible evidence has proven a significant number of those deaths are due to totally unrelated causes, like car accidents, and have nothing to do with the virus itself. Still, doctors say hydroxychloroquine could cure between 70 to 90% of the patients diagnosed with the disease. So if we take these numbers at face value, that means out of 154,000 dead, hydroxychloroquine could have saved more than 138,000 of those people. Yale professor and epidemiologist Dr. Harvey Risch agrees, saying if hydroxychloroquine were widely available to patients, it could easily save 100,000 lives or more across America. That means that radical leftist governors and politicians in Washington have allowed nearly 140,000 Americans to die just to prove President Trump wrong. Pearson Sharp, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.